Hello everyone, welcome to this video. I am SHUVRO BHATTACHARYA from Medical College KOLKATA. I am here for guide you in your first professional exam, how to make it easy, how to grab more marks, and what is the new curriculum. Okay, so I make the video in 4 segments. Firstly, I want to tell what is the curriculum change in your exam pattern. Secondly, what is the important topics of anatomy, of biochemistry, of physiology, which you have not to be skipped. Okay, and nextly, what is the most accurate type of answers, how to write, how to approach an answer. Okay, and what is your presentation. Okay, and the last topic will be on the AETCOM module. Okay, what is the AETCOM module, what are the questions may be asked. Okay, so I want to start with the new curriculum of the WBUHS. Okay, in this new curriculum of the WBUHS, you have to attempt 2 theory papers and each of them have 100 marks. Okay, the time you already know, 11 AM to 1:30 PM, and for the old regulation and who are the new regulation or the new batch, they have 11 AM to 2 PM. Okay, so this is the mass curriculum. Okay, now coming to the part of the questions. Firstly, some have long questions. Okay, long questions, the number will be 2 and they are the 15 marks of each, so 30 marks. There's some short questions, number will be 3, 10 marks of each and the 30 marks. Next, some short notes, one from the AETCOM module and one from the chapter or the subject. Each of them have 5 marks and 20. Now coming to the explain why part, explain why have 4 questions, one from the AETCOM module, each of them 5 and will be 20. And lastly, MCQ will be 4:1 type, that's mean 4 option, 1 will be correct, and there may be 5 or maybe 10. If 5, then each question carry 2 marks, and if 10, each question carry 1 mark. Total will be 10 are coming from the MCQ. So there is the total of the 100 marks of your exam. Okay, so this is the part 1 exam. Theory will be 200 marks, paper 1 and paper 2. It's clear? Okay, now I want to tell, please carry one book which you read or any paper, pen, and write what I am want to be saying. Okay, now I am tell some topics of the biochemistry, which you have not to be skipped, Okay, so let's start. What I am saying, please write or mark in your textbook, in your content. Firstly, from the carbohydrate part, which you have not to be skipped, the thing is the classification and the chemical structure of monosaccharide and disaccharide. This topic you have to be read. Okay, now come to the isomerism part. In case of isomerism, you have to prepare one long question, the isomerism. Okay, what are the stereoisomerism, optical isomerism, epimers, anomers, meta-rotation and specific rotation, and 1 or 2 example of each of them. You have to make one question on isomerism. Okay, now coming to the heteropolysaccharide and glucose NMG and glycoproteins and related with the clinical aspect. Okay, so heteropolysaccharide, glucosamine glycans and glycoproteins. This is the important topic from the carbohydrate. And the most important topic you have to read is the blood group. Okay, the blood group and the carbohydrate relationship. Okay, now coming to the classification of the lipids, come to the lipid part. Okay, so you have to read this much from the carbohydrate part. Now come to the lipid. From the lipid, you have to read what is the structure and function of the PG or prostaglandins. Okay, the prostaglandin pathway, leukotriene and thromboxane pathway, you have to read that. Okay, next you have to read what is the structure of the phospholipid surfactant, okay, and glycolipid. This is the most important part. Now they may be asked what is the structure of the cholesterol and the cholesterol metabolism. Okay, so cholesterol. Now coming to the next part, which is the protein. This much from the lipid you have not to be skipped. Now coming to the protein part. From the chemical aspect of the protein, you have to read what is the isoelectric pH, what is the acid base properties of the amino acid. Okay, Now, what is the electrophoresis, ultrafiltration and gel filtration? This much you have to read from the protein part. Now coming to the reactions of the amino acids, you have to read mean hydrogen reaction, you have to prepare paper chromatography, thin layer chromatography, high performance lipid chromatography, HDS, gel electrophoresis. You have to prepare these reactions and the tests from the amino acid reaction part. Okay, now coming to the protein part. In the protein part, you have to read what is the role of 2,3-DPG, what is the role of HbS, hemoglobin S or sickle cell anemia hemoglobin, and what is the HbM. You have to read this when the sickling is formation, when the sickling is not forming. You have to read this amount of from the structure of the protein part. Okay, hemoglobin and myoglobin is very easy, you may read or may not read, but this role of DPG, HbS, HbM you have to read. Okay, now coming to the collagen, keratin, elastin and fibrin part. You have to read some basic concept of the collagen, keratin and elastin part. Okay, now coming to the nucleic acids. What is the structure of purine? What is the structure of pyrimidine? Okay, what is the nucleotide? What is the derivative nucleotides? You have to write it. You have to study the derivative nucleotides. Okay, now coming to the structure and the properties of the DNA, different types of DNA and what is the length, how many base pair are formed. You have to read this amount of knowledge from the DNA structures. Okay, now you have to move on the RNA, mRNA, tRNA, hnRNA. You already know that. So you have to basic knowledge about the RNAs, just basic knowledge, not more than that. Okay, now coming to the most important part of your exam is the enzyme part. Okay, in case of enzyme, the first and the foremost important is the classification of IUB classification of the enzyme. You have to read that, and each of them one or two example with reaction. Okay, the apoenzyme, coenzyme, holoenzyme and cofactor, each of them definition and one or two examples. Okay, this is the IUB classification of the enzyme. Now coming to the kinetics, you have to read the significance of the Km, the reaction velocity, order of the reaction, from the curve of the substrate and the enzyme. You have to read this amount of kinetics of the enzyme. Okay, now coming to the factors affecting, you already know temperature, pH. You read from the class 11, the temperature, pH, substrate concentration, enzyme concentration, what is the effects on the factors affecting the enzyme activity. The whole things from the curve is very easy, just read out, it is very easy. And the most important thing is the from the enzyme part is the inhibitors of the enzyme actions. What is the inhibitors? You know that competitive inhibitors, non-competitive inhibitors, irreversible and suicidal inhibitor. You have to read 4 type of inhibitors. 4 types of, what are the 4? Competitive, non-competitive, suicidal and irreversible inhibitors, and each of them 2 or 3 examples. Okay, now coming to the function and non-functional enzymes and the significance of the non-functional enzymes. It is the very important things. Importance of the non-functional enzyme or clinical significance of the enzymes. It is the very important part of the enzyme. Now coming to the last part of the enzyme, the most important questions from the enzyme may be asked the ELISA. The principle of the ELISA is may be asked in your exam because it is the part of the enzyme. Okay, now coming to the some physical aspects of living matters in your chapter. So what are the clinical aspects of the basic matters, the living matters? You have to read most importantly the ATP cycle or ADP cycle. Next, the shuttle mechanism. What are the shuttles? Firstly, glycerophosphate cycle. Nextly, mallet shuttle and creatine shuttle. Okay, creatine phosphate shuttle. You have to read these shuttles. These shuttles are more important. Now coming to the role of the cytochrome P450. Okay, the role of cytochrome P450 and the generation of the superoxide and free radicals. You have to read this much. Okay, now coming to the next thing, what is the G protein and G protein coupled receptors, what is the cyclic AMP, and what is the IP pathway. You have to read, mainly you have to read each and every G protein coupled receptors pathway and the mechanisms. This is the very important. Okay, now coming to the metabolism pathway. So this much from the physical aspect. I am again repeating. Firstly, cytochrome P450, nextly superoxide and free radicals, ADP and ATP cycle, shuttle mechanisms, and the G protein coupled receptors, each and every. Okay, now coming to the metabolism of the carbohydrate part. Metabolism of the carbohydrate part. Metabolism of the carbohydrate part. So firstly you have to read the digestion and the absorption. Mostly in the digestion and the absorption part, the lactose intolerance part. The lactose intolerance part. Nextly, you have to read the allosteric control of the key enzymes. Allosteric control of the key enzymes in the glycolytic pathway. Very, very important. You have to read the glycolytic pathway, but you have to read the allosteric control of the key enzymes. Okay. Now coming to the glycogenesis and gluconeolysis, you have to read whole things. But I want to discuss the most important thing is the chemical structure and of the intermediate sites of the ATP production in the TCA cycle. It is the very important topic for your exam. Okay. Now coming to the abnormal metabolism of the fructose and galactose. This is the very important. The abnormal and the normal metabolism of the fructose and the galactose. Okay. Now coming to the PPP, pentose phosphate pathway, the importance of the generation of NADPH. Okay. NADPH is very important. You have to read from this because the glutathione, the red cell membrane rigidity, this is the very important pathway. Okay, you have to read PPP and the red cell membrane stability. Okay, now you have to read the glycosided hemoglobin, the procedure and interpretation of the glucosuria from this part, because this is the very important from the metabolism of the carbohydrates. From the metabolism of the carbohydrate, you have to read whole metabolisms firstly. Secondly, you have to read allosteric controls. Next, you have to read the chemical structure of the intermediate site of the ATP production from the TCA cycle. Nextly, what are the inhibitors, and thirdly the PPP, what is the importance of the generation of NADPH, what is the red cell membrane stability, and lastly the glucose tolerance test from the glycosylated hemoglobin, the procedure and interpretation of the glucosuria. Okay, you have to read this much from the glucose metabolism or carbohydrate metabolism. Coming to the metabolism of the lipid. From the metabolism of the lipid, you have to read, I have already a video on the lipid metabolism. You have to go through that. It is enough for the lipid metabolism. Okay, again I am discussing what is the most important part of the lipid metabolism. Firstly, the absorption and the digestion of the lipid, HDL, LDL, VLDL, chylomicron, this part, the absorption part of the lipid is very important. Nextly, what are the significance of the lipoproteins and what are the diseases from when the lipoprotein is absent. This is a very, very important topic, the lipoprotein part. Okay. Now, the energetic disorder of the fatty acid oxidation, already told. The ketone body degeneration, already in my video. The metabolism of the lipid in the liver, the lipoprotein factors and prevention of the fatty liver. This is the very important topic from the lipid metabolism. Okay, now coming to the biosynthesis of the fatty acid, the de novo synthesis, the multi-enzyme complex, I already taught in the video. The video of the lipid I will give in the description, the link. Okay, please go through that. The bile acid and the steroid hormone formation, the biosynthesis of the triglyceride and the triglyceride and the degeneration. This is the important part of the lipid metabolism, and the most important and energetic part is the insulin part. What is the chemical structure, synthesis and the transport of the insulin? What is the mechanism of the insulin, and what is the insulin receptor and insulin like growth factors? The insulin part is very important from the lipid metabolism. Okay, now coming to the metabolism of the protein. From the protein, you have to read what is the formation of the amino acids, mainly the urea cycle, the diseases of the urea cycle, the formation of the nitric oxide and formation of the disposal of the ammonia. So the urea cycle is very important. Now coming to some amino acids, please note it down. Firstly, sulfur containing amino acids, tryptophan, histidine, okay, melanin, phenylalanine and tyrosine. I am again repeating, sulfur containing amino acids, tryptophan, histidine, phenylalanine, tyrosine, melanin. You have to read normal and abnormal metabolism of these. Again I am repeating, sulfur containing amino acid, tryptophan, histidine, melanin, phenylalanine and tyrosine. You have to read the normal and the abnormal metabolism of these. Okay. Now coming to the synthesis of the heme. It is very important, synthesis of the heme and the enzymatic defect in the porphyria. It is very important. And also the degradation of the heme you have to read, and what is the conjugated on the unconjugated bilirubin. This is a very important topic for your biology, biochemistry and the physiology both. Okay. Now coming to the metabolism of the inorganic elements and the vitamins. This is the most important part because we all skip this part, but you have not to be skipped. What are the important vitamins you have to write or have to read? I saying vitamin A, vitamin E, vitamin K, folic acid, vitamin B12 and vitamin D. You have to read these vitamins. Again I am saying A, E, K, B, folic acid and D. It is very important. Okay. And what is the respiratory and renal mechanism to pH maintenance? It is very important. What is the ion gap? What is the ion gap? It is very important. And the zinc and selenium, these elements you have to read from the element parts. Okay. So you have to read this amount of, and what is the metabolism of iron? It is very important. The iron part is very important. So what are the elements? Iron, zinc, selenium. What is the vitamin? A, K, E, D, folic acid. You have to read this ion gap, anion gap and the respiratory and renal metabolism to maintain the pH. Okay. Now coming to the 4 tests you have to read. Firstly, renal clearance test. Secondly, liver function test. Thirdly, thyroid function test. And fourthly, gastric and pancreas function test. You have to read 4 tests. Okay. Again I am repeating, renal function test, liver function test, thyroid function test, gastric and pancreatic function test. Okay. And the purine pyrimidine metabolism I already taught. I give the description, the link of the video. Now coming to the cancer and the xenobiotics and the other genetic methodologies and genetic aspects. From this part you have to read firstly chemical and physical carcinogens, what is the oncogens and what is the proto-oncogens. Again, chemical and physical carcinogens, oncogens, proto-oncogens. Okay. What is the xenobiotics, metabolism of xenobiotics and detoxification. Okay. Now coming to the genetic methodology, you have to read the LFLP, RFLP. Now coming to the genetic methodology, you have to read the RFLP and TNTR. RFLP and TNTR. What is the southern blotting, northern blotting, western blotting and the applications. Okay. Now cDNA and the DNA technology. You have to read this amount of from the genetic methodology. Okay. Now coming to the genetic aspects, you have to read replication, though you already read, inhibitors you already read. Okay. Okay. So you have to read from this part of genetic aspects, the mainly the RNA, DNA, transcription, translation, lac operon. What is the biosynthetics, protein biosynthesis in the eukaryote and the prokaryote, this types of. Okay. So now I am saying this topic of the biochemistry you have not to be skipped. You have not to be skipped. And what is the paper 1 and the paper 2 in the biochemistry? In the paper 1 and paper 2, I think the syllabus will not changed. The paper 1, paper 2 demarcation will not changed from the previous year. I think only the structure of the questions will change, and you have to read these topics which I am discussed, but not these topics only read. You have to read. You have, if you got time, please read the whole topics. and the other topics also. This is the most important topics, not all topics. This is the most important parts. Okay, don't read only these topics and go to the exam. I want to say don't skip these topics. I want to say don't skip these topics. Okay, so now I am coming to the anatomy part. So again, you can write or you can mark in your book. Firstly, from the general anatomy, you have to read what are the types of joints. Firstly, second things, lymphatic system and the vascular systems, blood vascular systems. From the general embryology, you have to read germ cell. Okay, you have to read the notochord, neuroenteric canal, the interembryonic mesoderm. Okay, the placental abnormalities, the fetal circulation, what is the umbilical cord, what is the derivative of the ectoderm, endoderm, mesoderm, what is the gastrulation. You have to read these topics from the general embryology. Have to read, not this much, you have to read. Come to the genetics part. From the genetics parts, you have to read like karyotyping, firstly non-disjunction, anaphase lag, mutation and type of inheritance. Karyotyping, non-disjunctions, anaphase lag, mutation and type of inheritance patterns. Okay, and common genetic diseases. Common genetic diseases like Klinefelter syndrome, Turner syndrome, Down syndrome. Okay, but you have to read karyotyping, non-disjunction, anaphase lag, mutation and type of inheritance. Okay, now coming to the upper limb or superior extremity. You have to read from the superior extremity the brachial plexus, the mammary gland and the applied anatomy, the shoulder joint, elbow joint and the wrist joint. These three joints you have to read. Okay, and finally the first carpometacarpal joint and spaces of hand with carpal tunnel. You have to read from this, from the upper hand. Okay, or upper extremity. Now coming to the lymph nodes of the upper part, you have to read from the axillary lymph node, mainly from the upper limb. Coming to the lower limb. From the lower limb, you have to read femoral triangle, femoral sheath, hernia. Nextly, knee joint and ankle joint, and mechanism of the foot, what the mechanism of the walk. Okay, and lymphatic drainage with the applied of the leg. Now coming to the abdomen part. In the abdomen part, you have to read inguinal hernia, the umbilical hernia and the clinical significance. Firstly. Secondly, peritoneum development with their recess. It is the very important. Thirdly, the liver and the biliary apparatus with extra and interbiliary apparatus. It's the question. Nextly, the portocaval anastomosis. Portocaval anastomosis from the portal or the liver. This is from the liver part. From the peritoneum, you have to read the development of the peritoneum with the recess. Okay. Coming to the pelvic, the first thing you have to read the perineum, very important. Nextly, coming to the spleen. What is the splenic circulation? It is very important. Coming to the kidney. From the kidney, the blood supply of the kidney is very important. Now coming to the bladder. The nerve supply of the bladder and the mechanism of the mixturation is very important. Now coming to the blood vessels of the abdomen, you have to read the iliac artery, the internal iliac artery and its branches. Okay, and coming to the embryological part of the liver of the GI tree, you have to read the what is the hernia, what is the diaphragm hernia. You have to read that, and mostly rotation of the gut and development of the liver and the pancreas with anomalies. Liver and the pancreas with anomalies and rotation of the gut, and sometimes embryological defects of the kidney, they may be asked. Okay. Now lastly, the development of the genitourinary system. In this part, you have to read the kidney shaped kidney, the horseshoe shaped kidney, this type of terms of the kidney abnormality in the embryological part. You have to read that. Okay. Now coming to the thorax. From the thorax, it is very easy. Firstly, you have to read esophagus and thoracic duct. Okay. Next, what is the blood supply of the heart? The coronary blood supply of the heart. Secondly, what is the conduction system of the heart, and next, what is the blood vessels of the intercostal spaces and the bronchial tree, and lastly, from the embryological part of the thorax, the most important thing is the what is the development of the cardiovascular system is very important, very important, and what is the development of the diaphragm is very important, must read. Okay. Now coming to the head and neck part. Okay, from the head neck part, you have to read 5th, 7th cranial nerve separately, 5th, 7th cranial nerve separately, 3, 4, 6, it's very important, 3, 4, 6 with cavernous sinus, it's one part, and lastly 10th, 11th, 12th is another part. Read 5th and 7th separately, 3, 4, 6 with cavernous sinus in a part, and 10th, 11th, 12th another part, but read 5th and 7th separately. And middle ear cavity is very important. The intervertebral joints is very important. What is the applied importance of the carotid sheath? What is the applied importance of the carotid sheath is very important. Dural venous sinus is must read. And what is the development of the pituitary? What is the development of the pituitary? It's very important. And lastly, you have to read what is the bronchial apparatus, development of the face, palate, and the nose and the tongue, because they can ask from the clinical part of this, like cleft palate, cleft nose. You have to read this from the head and neck part. Okay, and if you have got time, please try to read the orbit. Okay, this much. What is the tongue and the muscles of the tongue is very important. Now coming to the CNS part. From the CNS part, you have to read what is the cerebellum and the cerebellum nuclei. Nextly, what is the CSF and the CSF drainage pathway, from the what the CSF is secreted and what is the drainage pathway. Nextly, the most and very important thing is the blood supply of the brain. Blood supply of the brain is very important. And what is the white fibers of the brain, like internal capsule and others. It's very important. And subarachnoid system is very important, is you have to read in the CSF part, and this is from the CNS. So what I am discussing, just wait 1 minute. Yeah, from this part you have to read the anatomy. Anatomy is very short, believe me, anatomy is very short. Please try to read from these topics which I am saying. After the completing these topics, go the other topics, but don't skip these topics. Don't skip these topics. I am again saying don't skip these topics, but you have to read these topics. Okay, so this is the anatomy part. Now coming to the physiology. From the physiology, first the general physiology, you have to read the what is the homeostasis, resting movement potential, action potentials, and the most important things is the intercellular connections from the general physiology. Coming to the nerve muscle physiology. In the nerve muscle physiology, you have to read the neuromuscular transmission and the clinical aspects. Secondly, what is the structural anatomy of the skeletal muscle, mechanism of the muscle contraction, the energy sources, isometric, isotonic contraction, and the motor unit, and the size and the principle of the muscle contraction and the mechanism of the contraction of smooth muscles. Okay, again I am telling neuromuscular junctions, motor unit, rigor mortis, it's come under the muscle contraction, the mechanism of the muscle contraction and the relaxation, and the smooth muscle mechanism, smooth muscle contraction mechanism. Okay, now coming to the blood, you have to read PCB, MCB, the red blood incidence. Okay, the red blood indexes, right? PCB, MCB, MCH, MCSH, you have to read that. Okay, yes sir, you have to read that. Okay, now coming to the anemia. What is the types of anemia? It is very important. Next, what is the polyarrhythmia? Very important. And again the iron metabolism, again from the biochemistry and the physiology, iron metabolism. Okay, now coming to the immunity part, you have to read what is the mechanism of the immune response, what is the immunoglobulins. Okay, and coming to the platelet, you have to read what is the role of platelet, why the importance of the endothelium of the blood vessels, what is the mechanism of the anti-clotting in our body, and you have to read the anticoagulants, and why vitamin K deficiency, what is the tests of the bleeding disorders, and you have to read the blood group with the blood transfusion hazards. Okay, you have to read this much from the blood part. Okay, if you have time, please try to read the thrombosis part. Okay, now coming to the GIT. The GIT system, from the GIT system, what is the characteristic of the GIT wall? It is very important. Okay, now coming to the next, GI hormones, which is stimulating, which is inhibiting this part, the GI hormones, and the most important things, the neural control of the GI movement. Okay, now coming to the gastric juice part, you have to read the gastric juice part with association with the damping syndrome of the gastric juice part. Okay, coming to the liver and the gallbladder, you have to read the LFT, liver function tests, the gallbladder stones, and the jaundice part. You have to read that from the liver and gallbladder. Come to the small intestine, you have to, from the small intestine, you have to read the regulation of the secretion of the intestinal juice. From the large intestine, you have to read only the function of the large intestine. Okay, you have to read from the large intestine only the function, and the absorption is already in the biochemistry, not asked here. But most important from the GIT is gastric motility, gastric emptying, the small bowel waves, peristalsis, paralytic ileus defecation. You already know that. So this you have to read. I am again saying gastric motility, gastric emptying, small bowel wave, peristalsis, paralytic ileus defecation. Okay, you have to read from the GIT that much. Coming to the respiratory system, from the respiratory system, you have to read the pulmonary ventilation, the alveolar ventilation, and the dead space. Okay, pulmonary circulation, the lung volumes and the lung capacities. Okay, and the importance, clinical importance of this. And you have to read the oxygen and carbon dioxide transport. Already you read in the class 11. It is very important and very easy. And the neural control, chemical control, response of the exercise, and periodic breathing. Again I am saying neural control, chemical control, response of to the exercise, and periodic breathing from the respiratory system. And the last thing of the respiratory system is hypoxia. Hypoxia, cyanosis, asphyxia. This hypoxia to the high altitude, you have to read each and everything from the hypoxia part. Okay, and lastly, what is the nitrogen necrosis? What is the high pressure nervous syndrome, decomposition sickness? Again I am saying nitrogen necrosis, high pressure nervous syndrome, decomposition sickness, and the artificial respiration. These four you have to read. Again I am saying nitrogen necrosis, high pressure nervous syndrome, decomposition sickness, and artificial respiration. Okay, now coming to the cardiovascular system, it is very important you know that ECG leads. Firstly firstly the ECG leads. Secondly, what is the cardiac cycle? Jugular vein, the heart sound normal, and the physiological basis of the splittings. This is very important. Nextly, the cardiac output, what is the venous return and factors affecting to the venous returns. Come to the arterial pulse, what is the abnormal pulse, what is the normal pulse. Now coming to the arterial pressure, what is the total pressure, what is the Bernoulli's principle of the pressure, what is the effects of the posture, exercise, gravity in the pressure. Again I am saying what is the factors controlling BP and the gravity, posture, exercise effect on the BP, very important. Coming to the regulators of the HBA, CVS, what is the nervous regulation, what is the substance regulations, and what is the hormonal regulation, you have to read that. And lastly, the cardiovascular reflexes. Again I am saying this cardiac cycle, ECG, heart sound, cardiac output. Okay, arterial pulse. Okay, from the pressure part you have to read what is the control factors affecting the BP, gravity, posture, exercise on the BP. Next you have to read the hormonal control, neural control, the splitting of the heart sound, the cardiovascular reflexes from the heart. Okay, Now coming to the hemorrhagic shock part. You have to read the hemorrhagic shock part from the cardiovascular system. And what is the coronary circulation, what is the cutaneous circulation, pulmonary circulation, cerebral circulation, renal circulation. Again I am saying coronary, cutaneous, pulmonary, renal. Coronary, cutaneous, pulmonary, renal, cerebral. This 5. Coronary, cerebral, renal, pulmonary and cutaneous. This 5 you have to read. Okay. Now coming to the endocrine system. From the endocrine system, you have to read and must read the parathyroid, thyroid, and mainly the importance of the hypo and hyperfunction of these glands. Which glands? Pancreas. Firstly pancreas, second the parathyroid, thirdly thyroid. Okay. Now coming to the pituitary and hypothalamus axis, you have to read that, and the calcium metabolism. This much from the endocrine. And the mechanism of the hormonal action, you have to read, you have read from the NCERT, the lipid soluble and the water soluble mechanism, you have to read that. Okay. Again I am saying from the endocrine, thyroid, parathyroid, pituitary, pancreas, the hypo and hyper activation of these glands and what is the mechanisms, and the calcium metabolism. Come to the reproductive system. From the reproductive system, you have to read spermatogenesis, firstly the abnormalities of the testicular functions, cryptorchidism and male hypogonadism. From the female reproductive system, you have to read what is the estrogen, progesterone, relaxin, control of the ovarian cycles, the hypothalamic and pituitary hormones. Okay. Next you have to read the menstrual cycle, uterine cycle, ovarian cycle. You have to make one note on the menstrual cycle. Okay. Now coming to the what is the progesterone metabolism, you have to read that. The lactation and contraception you maybe read. Okay. Now coming to the excretory system. From the excretory system, the nephron part is very important. What are the pumps, what are the mechanism of the pumps is very important from the renal. The TM value is very important from the renal. The jugular, the JM apparatus is very important from the renal, and the osmolarity from the renal. Nephron part, the TM values. Next the filtration barrier or JM apparatus, and the mainly the nephron structure, focus on the nephron structures and the osmolarities. Okay, this part from the renal, and already taught the mixturation of the kidney bladder, this is very important. Now coming to the nervous system, this is the most important and most hard, but you have to read CSF, blood brain barrier, CSF circulation and dural plexus. Next, pain types and all the pain management you have to read. Next, what is the ascending pathway, descending pathway, pyramidal, extrapyramidal, upper motor, lower motor neuron lesions, hemiplegia, paraplegia, monoplegia, you have to read that. Motor system, motor cortex, descending tracts, ascending tracts, pyramidal, extrapyramidal tracts, upper motor neuron lesion, lower motor neuron lesion, hemiplegia, paraplegia, monoplegia, you have to read that. Come to the injuries of the spinal cord. Injury of the spinal cord is it is very important, semi-section or hemisection and the complete injury. You have to read that, and you have to read the basal ganglia, which is most important topic. You have to read the basal ganglia, and you have to read the EEG part, and physiology of the limbic system. Okay, physiology of the limbic system. You have to read this much from the nervous system. Now coming to the special senses, you have to read the smell pathway, the speech, learning, memory, higher function of the brains, the taste bud pathway, the vision pathway and the hearing pathway. You must read, please, you must read. Vision pathway, hearing pathway, smell pathway and taste pathway. If you don't want to read smell and taste, but you have to read the vision and hearing, you have to read. Okay. And the speech and the learning of the memories. Okay. So I want to say this is the suggestions or the important topics of the physiology, anatomy, biochemistry, important topics. You have not to be read, you have not to be skipped, you must read topics, but this is the last minute topics, you have to revise that. But please go through that previous 10 years supplies and regular questions to ensure your mask. Okay, now I am coming how to write an answer. Okay, so in your curriculum, what I am knowing that there are 2 or 3 mask question may become as long, or maybe more than that, if more than that, maybe 4, last 4, but maybe the 3 is the highest mark in your question paper. So what is your skill? Don't write like a paragraph wise. First thing, first point, don't like a paragraph wise. Firstly, give the question number. Second, after the giving the question number, read the what is the heading of the questions. Okay, next click a write a box and put the summaries. Again box, you have to make presentation in your papers, not like a reading, not like a writing essays, not essays. It is like a presentation in your work. Okay, what is the presentation? Like, what is the function of the progesterone? This is the paper, write progesterone in the middle and give arrows all sides and write the mechanism or the function of the progesterone in like that, like a sun rays. Okay, or maybe some flow charts, 1 2 3 4 boxes and 4 procedures and give the arrows. Okay, you have to make your note or make your answer sheet like one presentation, because the teachers have not much time to read the essays. Please make sure that what you want to say, and you have to say this much to the point answer. You have to draw some diagrams in each of questions, draw some diagrams, relevant diagrams in each of questions, and try to make your question like a flow chart, not like essays, not like essay. But don't give a flow chart and complete the answer, don't write that. Give a flow chart and just describe the flow chart in 2 lines, that's it. Give the flow chart, describe the flow chart in the 2 lines, give the diagrams and describe the diagrams in 2 lines, that's it. Secondly, you have to write to the point, concise and to the point. Which you have don't know, leave that question. Please don't make tukka and write the wrong things, please don't do that. Okay, please make a presentable answer sheet, not like this type, not like. You have to read like tables, flow charts, like you have to mark or you have to highlight the area you want to highlight. Please highlight that area by underlining that, by making a box around that sentence or that topic or that function. What is the main function? Give the box, give some arrows. Just make your paper presentable. If I am teacher, I am not teacher. If I am teacher, when I am reading your answer sheet, I am getting excited, I am getting interested. What you read there, you have to make your examiner very excited, very happy to see your answer, because they have immense pressure. You have to concise your answer and you have to make a presentable format by which your examiner just look and they get the answer. They get this boy or this girl knows something. You have to write that. Okay, if any problem how to write the questions, how to write the short notes, you in the WhatsApp group, just call me anytime, just call me, I will tell you these questions you have to this write. Okay, now coming to the most important, the AETCOM module part. The AETCOM module part, you have to read the 94 pages AETCOM modules, and I am saying wait 1 minute. Okay, firstly you have to read from the AETCOM modules. First, what is the ways of communications, barriers of the communications, what is the need of the communication teaching and the skills. You have to read the communication, patient party communications, patient teacher communication, doctor teacher communication, patient doctor communication, you have to read that. How to give one sad news, how to give one dead news, okay, how to treat one excited patient, how to treat one very non-cooperative patient. You have to prepare on question like that. Okay, now the next questions. Firstly, professional qualities or role of physician, write that. Next, commitment to lifelong learning. What is the importance of the lifelong learning? Role of the physician in healthcare system, physician's responsibility to the society. Okay, next, the physician's responsibility to the society. What are the 4 questions? Again I am repeating. Professionals and role of the physicians, commitment for lifelong learning. What is the importance of lifelong learning? Role of the physicians in healthcare system, physician's responsibility to the society. Next, professionals or quality of the empathy to the patient. What is the empathy to the patient? You have to make on that question. Next, the empathy, how to deliver the sad news or bad news. I said that. How to handle an emergency situation. Okay. Next, the communicate to the patient with respectful, not judgmental, empathetic manners. How to make like that. Demonstrate the correct procedures handling the cadavers and other biological tissues. You must read this type of questions. I am saying this much. You have to these types of questions from, you have to prepare like that. Okay, so please note the questions what I am saying from the AETCOM module. Prepare this type of questions, and all the best for your exam. And any problem, ping me or direct call me. And I think this is the topic. If you need anything, please inbox me. Thank you so much.